Good morning.
Good morning.
Well, I am Bobby Watts, the CEO of the National Healthcare for the Homeless Council, and I am thrilled to officially open our first ever Consumer Leadership Summit. So give yourselves a round of applause for being here. I understand that many of you came from far away. I know we have a delegation from California, we have a delegation from New York, including some of my former co-workers that care for the homeless, and just thrilled for people. Just curious, who thinks they have come the furthest, the farthest? Okay, from where?
Los Angeles, California.
Los Angeles, California, got a bunch there.
I can't beat that.
Anybody can beat that? Okay, Art.
Portland, Oregon.
Portland, Oregon, with the, yes. Seattle, Washington, okay. We got the West Coast, okay. So people have come from far and wide, and that just shows the importance that you place on this topic. I really want to thank our staff and our consumer leadership that came up with this idea. So this is a living example of when we listen to those with the lived expertise or the lived experience, what happens. So, this would not have happened without the hard work of our National Consumer Advisory Board and our hardworking staff, especially the director of the Community Engagement Team, who's been in touch with many of you, all of you, Cindy Manginelli. So just thank NCAB, thank our staff, and Cindy, for being here, for making it possible to be here. So I think this is one of the most consequential meetings. This has a potential of being one of the most consequential meetings in my probably 30 years of being involved with Healthcare for the Homeless and the National Healthcare for the Homeless Council, first as a member and the last 5 years as CEO. And that is because this goes to the heart of what we are all about. So I'd like to introduce the council by going over our mission statement. So I put it up here, and then I'm going to tie it into what we're doing today. So our mission statement is grounded in human rights and social justice. The National Healthcare for the Homeless Council mission is to build an equitable, high-quality healthcare system through training, research, and advocacy in the movement to end homelessness. So people say, what is the council? And we had the struggle, and we wanted to say we're actually several things, but the grounding of what we are is that we are a human rights and social justice organization. We believe that healthcare and housing are human rights, and that trying to secure those rights in this country so that they are realized for everyone in this country is a matter of social justice. And we want to build an equitable, high-quality healthcare system. And this is where we come in today. And these words are, the order is very intentional. We put equitable before we put high quality. Because we believe that we can't really have a high-quality healthcare system if it's only for some. If it's not for everyone, then that's not the high-quality healthcare system that we want. And we have a long way to go there. And the way that the council carries out our mission is we do training, which is what we're going to have here today, research and advocacy in the movement to end homelessness. So we are here, and you are helping us, and to helping thousands and hundreds of thousands of people experiencing homelessness throughout our country, now and in the years to come, until we end homelessness, to have better health care and to help the healthcare for the homeless programs, the medical respite programs, do a better job at listening and involving those with the lived expertise, not just in surveys, but in the leadership of forming programs and making sure that the services are good and proper and effective. So I looked up something, and this is from a business point of view, and I purposely wanted to keep it in this way because I believe in the human services, we are about the only sector that does not do as good a job as we should in listening to our customer. Now, our word for patients is consumers, and I asked, so why do we use the word consumer instead of patient? And Cowboy said, we use that term because we want to make sure that everyone knows that if it wasn't for us, the people receiving the services, the whole system would not be in there, would not be there. People wouldn't have jobs, they wouldn't be doing this job. So that's our way of saying we want to make sure that we're keeping the person receiving the services at the center. But for business, they use the term customers. But the concepts are the same. Who are you serving? How well are you serving them? And if you're not going to listen, you're not going to be able to serve them well. And human services is one of the worst sectors at listening to those that they are serving. If someone buys a Ford instead of a Toyota doesn't say, "Oh, those silly people they're Ford resistant. They don't understand how good we are." No, you haven't done a good job of creating your services well, or explaining it, or making it accessible. So just quickly, from a business point of view, it says listening to customers gives you valuable feedback. I really believe that complaint data is one of the most valuable pieces of information that any organization could ever receive. Finding out from the customer or the patient or the consumer's point of view what didn't work for them. And listening to customers help you understand your product better. And for us, our product is healthcare, it's human services, it's making sure people get the services that they need. And the fact is that every human service organization believes or likes to believe that they are client-centered, consumer-centered, patient-centered. But the fact is, because of our blind spots, many of our processes and the way we do things is because it makes the organization and their staff, makes their job easier. So we will never really understand that because of our blind spots unless we are listening to those receiving the services. It also says that listening improves customer loyalty and retention, and where that is effective is because when we are thinking of high-quality healthcare, one of the most important things is that there be continuity of care. You don't want to see someone just once and you never see them again. You want to engage them in such a way that they want to keep coming back so that they can receive the services, because you're not going to solve health problems in one visit. And even if you do, it's going to be ongoing health care and preventive care that needs to be delivered over time. But if people feel that they are not being listened to, if they don't feel that you have their best interests at heart, if they don't feel that you are trustworthy, then why should they trust you with the most important thing that they have, their health and their lives? So also listening creates brand ambassadors. And this is so important. The most important thing you want your patients to say is to go to someone else and say, you can get good care there. They will listen to you, they will respect you, and likewise, the word gets out on the street, so to speak, pretty quickly if you give good care. And if you give bad care, it goes out on the street very quickly also. Don't go there, they don't respect you. So we want to make sure that we are listening so that we can improve our services. But just listening is not a cure-all. And we should remember, though in business they say the customer is always right, we know that every individual customer is not always right. And we know that because different customers will have different opinions about the same thing, about how you should improve. And customers don't always know what they want. Now, I want to say this with a caveat. Henry Ford said, if I asked the customers what they wanted, they would have asked for a faster horse. Steve Jobs always said, they won't know what they want until we put it in their hands. And that can be true, but customers always know what they don't want. And I think about this with our work. In New York and now here in Nashville, I would do, on a volunteer basis, do outreach. In New York, it was street outreach. Here, it's to encampments. And many people would say, would you want to go to a shelter? Would you want your own apartment? And many people would say, no, I'd rather be out in the woods. but that was because they couldn't really imagine the future, a better future. They've been beaten down by the system so much, and they just associated, no matter what you said, with something that they already had a bad experience with. But what we've seen in response to COVID, many people who would not have been able or even would not have agreed to leave their encampment or to leave the streets have gone into apartments, have gone into single room occupancy, have gone into hotels, and that was one of the great lessons for me. For about a year, I didn't do outreach because of COVID, and when I resumed, so many of the people, including people I had conversations with, they said, I want to stay here, I don't want anything else. We were visiting them in housing. They had housing because we were able to show them, yes, there is a better way. It doesn't have to be a dormitory shelter, though those are often, they can be really good and high quality. But what they wanted was beyond their imagination, that they could have a place where they could lock the door, a door they could close behind them and lock it, and they could feel safe. So we also need to remember that there is a silent majority and a loud minority. So we should be really, really careful, because where I say complaint data is very, very helpful and very valuable, it is, because most people don't complain, even if they get bad service. In business, surveys show that only 1 out of 26 customers that got a bad experience will go to the trouble of complaining. So when someone does complain, that's really important, but we should not think that is the whole story. So how can we maximize listening and overcoming some of the shortcuts? So I say this is like a progression in listening to consumers. There's the individual feedback. Someone raises a concern to you. You want to hear that. But you can't just rely on one person's point of view if you want to improve your services. So you want to get surveys. You want to get input from a large group of people. But even surveys have their weaknesses, because they're going to be predetermined questions and responses, and then it's hard for people to take the time to think outside the box. Most people don't fill in when you say, what else do you want to tell us? So focus groups are another way of getting information from people where they can raise questions beyond what you can put on a piece of paper. They can feed off of someone else. The conversation can go in different ways so that you can get good feedback. But even, I think, a step up over focus groups is consumer advisory boards, where you have a structured way from a group of people getting information to a health center, to a medical respite program, of what's working, what's not, but even more important, what can you do differently? What can you do better? What additional things can you do that management would not think of, but those experiencing the services know, and they have many, many great ideas. Medical respite exists in part because the Boston Consumer Advisory Board said this is what we need, or consumers from Boston said we need a place when we're coming out of the hospital. Medical respite did not exist before. But by listening and having a way for consumers to give input to saying what they need, you can only improve if you take that under advisement and then try to work on it. A further progression is board of directors, making sure people with the lived expertise of homelessness are on the governing board of directors. This is so important because they guide the organization. They hire and fire the CEO. They set the policies for the organization. So having people with that lived expertise at the decision-making tables, setting governance for the organization is so, so powerful. As a black man, I know that when I am in the room, it's a different kind of conversation than when than when there are no people of color in the room. I know that because I see the minutes from when I'm there and when I'm not. And it's the same thing. the questions that are raised, the ways that people feel comfortable talking. And it's the same way once you have people with the lived expertise of homelessness at those tables, at those rooms, the conversation will change. It'll be more informed, it'll be more directive, and there'll be more diversity of opinions. And I don't want to leave out the importance of hiring people with the lived expertise of homelessness on the staff, on the management, and even in executive leadership. One of our great friends as an organization is the National Coalition for the Homeless, and their CEO is here. He's going to lead a session, and he leads he tells people, I bring with me to this role the lived experience of homelessness. And that is so, so powerful. At the council, I'm really thrilled that we've always taken this seriously, and we've even in the last few years have said we want to make sure we never have below a certain percentage of people with the lived expertise of homelessness on our board of directors. They're on every committee, they've always been on every committee, every board committee, but we want to make sure at the highest level of the organization we have people with the lived expertise of homelessness. So I also want to just close with a few thoughts, and that is that high quality services are most important when there is limited choice. In business, if someone says, well, they don't like our services, they can just go somewhere else. But when you are poor, when you're experiencing homelessness, you don't have as many choices as other people. And that is why it's even more important for those who are serving people experiencing homelessness, those of us in human services, to go the extra step to make sure that we are getting the input, that we are involving people with the lived experience in leadership. Because they don't have a choice. This is what they have. We have to make it as good as we can. And we know that as a leader, we can't make it as good as we can unless they are also involved. So consumer leadership helps to reduce health disparities. Right now, the council is in the midst of a vaccine ambassador program. We have a number of them here. Christopher Mack from LA. We have other people that are here. Raul Gonzalez, my colleague from the Bronx, are here. And what these programs are based on is peer staff. People with the lived experience reaching out to those who are experiencing homelessness because they speak the language and help them understand the importance and the benefit of getting vaccines in ways that they can understand, in ways that they can accept or reject, but in a knowledgeable way. So consumer leadership helps to level the playing field between those who have lots of choices and can go wherever they want, to those who have limited choices by making our services as good as possible. In other words, it promotes equity or fairness by leveling the playing field, by helping to reduce health disparities. So the council's, the council's strength is that everything we do is powered and informed by people on the front lines. Whether that is clinicians, whether that is administrators, and especially those with the lived experience of homelessness. And what we do, our secret sauce, is that we create a place where people can learn from each other. Those on the front lines can learn from each other, learn what's working, even learn what didn't work, so that we can shorten the learning curve for everyone. And that's why, on this important topic, this is perhaps one of the most consequential meetings that I've ever been a part of in the council. Because we're going to learn and share and learn from each other, because the expertise is in this room. We're going to learn from each other how consumers can use their voice in the most effective way, and how health centers and medical respite programs and those in management can make sure that they are creating space and the processes so that voice can be in a leadership position, helping to guide the services and the health center. So I just want to thank you for coming. Thank you for this time. And we are going to go forth even though we'll be in this room and stay in the hotel, but we're going to go forth metaphorically to learn, and then take that back, and most importantly, put it into action. I'm really looking forward to what we are learning. The expertise, everyone in this room is a subject matter expert, and we have work for you to do. And so I'm looking forward to working with you and looking forward to the output of that work as we work to build an equitable, high-quality healthcare system as part of the movement to end homelessness. I'm going to turn it over to Cindy Manginelli, and thank you very much.